Hi, I'm Janelle Ocampo, a doctorally prepared nurse practitioner. I specialize in facial aesthetics. I also specialize in ultrasound. Today, I'm going to talk about a new technique in identifying dermal fillers underneath the skin. Ultrasound is an emerging modality in facial aesthetics, but it does have a significant learning curve. When I went to ultrasound school, I had 2,000 hours by the time I reached graduation. So I can understand why learning this modality over the course of 1 to 2 days can feel daunting. Similar to learning how to inject dermal fillers, it takes time and practice. Most of us attend many trainings when it comes to learning dermal fillers, and we continue attending trainings so we can pick up new techniques. Well, the same thing applies with ultrasound. Attending multiple trainings in ultrasound can be very helpful in learning new techniques and improving ultrasound skills. So please don't get discouraged and put your ultrasound in the closet. There are some simple things that you can do to help get more proficient with ultrasound. You can target certain arteries and look for those in each of your patients before you inject them. You can even have someone assist you and scan or you scan while the patient is being injected. So you can actually see the dermal filler as you're filling in that space. And you'll probably be surprised on how the filler actually sits. You can also scan right after injecting that patient so you can see how their dermal filler is sitting underneath their skin, and you can get used to looking at what dermal filler looks like. One common question I get is how to identify what dermal filler looks like when it's underneath the skin. I've previously spoken about looking for the anechoic foci with and without posterior enhancement, but I know that it's not always that simple. There can be internal echoes, and depending on the size of the filler and how old it is, it may not be as obvious. And sometimes older filler can look very obvious because it's encapsulated. If it's encapsulated, then we see an echogenic border around it. There's a cool method or tool in helping to identify hyaluronic acid-based dermal fillers, and I want to share that with you. This technique was discovered by Alfredo Ferreira. It's called Fremitus Filler Identification Technique. I'm not completely new to this technique, but I am new to this technique to identify hyaluronic acid filler. What I do know is that what has already existed in ultrasound is what's called a power Doppler vocal fremitus test. It's a technique that I used when I was a sonographer and I was looking for malignant breast lesions. What we would do is identify the mass and then turn on power Doppler and have the patient hum. The surrounding tissue lights up and the mass doesn't light up. This area of interest is spared. I was so excited and mind blown to find out that we can also use this technique for facial dermal fillers. During a recent training, we practiced this technique to help the providers get more comfortable in identifying hyaluronic acid fillers. They were using a Clarius L20 when practicing this technique. I grabbed my phone and recorded a couple video clips, and I'll go ahead and play them here. You can hear how much fun we're having humming and watching the screen light up. You can see the strength of the hum does affect how well filled in the screen is. So it's good to practice this with the patient, have them hum lower and have them hum higher, and see if there are any tissues or regions spared, especially an area that you have of interest that you're wondering is a dermal filler. I was surprised to see how well the hyaluronic acid pockets were identified with this technique. I also tried this technique with a Vscan Air 12 megahertz, and I found it very effective. However, with the Vscan Air, they don't have power Doppler as a feature on it, just color Doppler. So I used color Doppler and it worked really well. This is an excellent technique, especially for those that are figuring out how to identify dermal fillers, adjusting your gain, getting used to seeing dermal filler within tissue. It's also helpful in rooms that don't black out and you're having a hard time telling on the screen whether something's anechoic or not, or it's a small area of interest. The F-fit or fremitus filler identification technique can be very helpful in identifying the dermal fillers, especially for newer sonographers, aesthetic facial sonographers. So please keep practicing, keep scanning. You've got this. I'm rooting for you. If there's anything else that I can do to help support you in this journey, please let me know. If you've liked this video, please subscribe, like, leave a comment, and thank you very much.